lenses. That's the lens sticking out onto the lid margin. Those get enucleated as well. I just thought I'd go through this just because it's kind of interesting. The way we are all taught to do enucleations is quite an old procedure. And in the old days, the ophthalmologists were not respected at all. They thought maybe one of the reasons was because of how enucleations were done. Um, they were done in humans with no anesthesia. They had several guys, I guess guys, big people, sit on you, and they put cold water against your eye and puts a big needle and with it connected to a thread along your sclera, and then pulled forward and cut your eye out with a curved knife. Boy, doesn't that sound good? Aren't you glad you're listening to this today? But anyway, the procedure has been described as one of the most severe and repulsive operations in surgery, so dreadful that many refuse to perform it, and inhuman except under the greatest and most urgent necessity. In enucleation, you're taking out the globe, and maybe, and generally you don't want to leave too much behind. You are leaving the periosteum, and you want to remove secreting tissue. The simplest way to remove all the secreting tissue, the conjunctiva, the lacrimal gland, everything, is suture the eyelid shut and do the transpalpebral technique. And so you suture, suture the lid shut, dissect posteriorly, transect the muscles, and so forth. I mean, here's one way to do it. Here's you can suture or use towel clamps. A lot of swelling in this eye in there before we even start. And just dissect. It's a bloody procedure for an ophthalmologist, not for some of the other horse surgeries, I guess. Transecting the optic nerve. I like to clamp it and then cut it. A few people still try to ligate the optic nerve and then cut it, but I don't have any luck with that. You're working blindly in this, in a sense. You can't see what you're doing. I mean, here's we've made a dissection now. Here's the just dissecting the tissue away. You know, then suturing the conjunctiva, I'm sorry, suturing the deeper fascial tissue. You've removed this conjunctiva. And then suturing the lids, suturing the skin. I bandage them for a day or two, just put pressure on the eye so it doesn't swell too much. This is generally considered to be an extremely painful procedure, and yet most of the time I do enucleations, you can tell the horses feel better afterwards, so they must have been in a lot of pain before. Warn the owners what they're going to look like. They don't like these pits. I don't like them either, but the horses usually don't care, and the owners usually get rid of it. Okay, everything did okay. Orbital tumors are notoriously bad in all species. Highly malignant generally, causing exophthalmos on the left side in this horse. The image on the right side of the screen, you can see there's a mass behind the eye on the right, on the left side. I'm sorry, on the left side. And generally, the exophthalmics is so bad that they requires enucleation to try to save their life. But these can be highly metastatic types of tumors. The arrow is pointing towards the swelling and exophthalmos. There's the other arrow in the image showing the tumor behind the eye. Squamous cells behind the eye. These are bad things to do. I mean, we're trying to save the horse's life as long as possible in these, but just bad situations. You see the two terms exophthalmos and enophthalmos. Exophthalmos means there's something in the back of the eye that pushes the eye forward. It could be inflammatory tissue or neoplastic tissue. Enophthalmos means there's a loss of orbital contents in the eye. The globe moves backwards. Buphthalmos is when the eye itself gets big, which is in glaucoma. So exophthalmos is a prominent eye from something pushing the eye anteriorly. Enophthalmos is the eye moving posteriorly because of a loss of orbital contents.